many aspects of care in the emergency department that relate to ongoing observation, and we have medically and nursing directed systems in place where we keep an eye on such things as your blood pressure and heart rate, and they will trigger responses from our staff, but that's more at a nursing and medical level. One of the challenges that staff in the emergency department face that your GP and GP practice nurse don't necessarily face is that we're often meeting you for the first time and we don't have a long-term relationship with you that helps us to perhaps understand some of the subtleties that have changed and that are worrying you about your current health circumstances. So as well as the internal responses that we have to make sure that you improve as a result of coming to the emergency department, what's also important and very helpful for us is that as a patient or as a relative or friend of a patient, if you're worried about something, please let one of the staff members know. We have boards in the department where it clearly shows who your treating team is, both doctor and nurse. So if you're worried about something, if you think that something hasn't been emphasised strongly enough, then letting your treating team know will very much help us to provide a higher level of care to you, and also hopefully improve and reduce the time that it takes to make you feel better. So some of the things that people may be concerned about would be a change in their symptoms following their arrival in the emergency department, or a worsening of a symptom that was already there, such as pain that's getting worse, particularly if we've tried to improve your pain. If it's getting worse, we'd really like to know, both to make your symptom less uncomfortable, and also it may give us some additional information to arrive at the right diagnosis and treatment in a more timely fashion. There are several ways that you can let the treating team members know. Both you can use the nurse call bell, or you can just directly approach one of the team members to alert them to your concerns. In essence, if you're worried, then we want to worry for you. We want you to focus on getting better and let us worry about how to make you better most quickly.